Addressing neck bands is not like just like a simple thing. In a sense, it's not like a straight answer. It will depend on the person. Someone might have early neck bands like I do, for example, and I can very well treat that or improve that with just using Botox. Botox is actually a very important way to treat the neck. Usually the neck bands are from muscles, from this muscle here, and over time that muscle just relaxes the edges and you develop the band. So treating Botox is an important part, especially on the early stages of a neck band. Once the neck bands are present all the time, even at rest, then what you end up needing to do is to do a facelift and a neck lift. Neck bands are basically the visualization of the muscle that sits under the neck. There is a muscle that goes from our clavicle all the way to the jaw. It's called the platysma muscle, and this is this muscle here, okay? And over time, this muscle we use a lot when we speak, when we eat, when we move our neck, and over time this muscle will relax. As the face descends, will relax, and then people will tend to develop usually those bands along the neck here. When we're looking at neck bands, we're basically looking at the edges or the platysma muscle. So how do we treat that? One way to sort of like prevent that or perhaps better to delay the appearance of neck bands is to use Botox on the neck. That's a very effective way to treat the neck band, on the early stages. Obviously, taking good care of your skin is an important piece as well. And there is certain skin cares that are dedicated for the neck, and those are going to be an important part. But ultimately, when someone has neck bands and you can see those bands at rest, really the way to treat that is going to be a surgical procedure such as a facelift and neck lift.